We're going to begin right now with a very serious problem, one that I'm actually have had experience with, and that's what we used to call bed sores. Our guest is Dr. Bardia Anvar from Skilled Wound Care. He's on our line now from West Los Angeles. We're going to talk for the next few minutes about tips to prevent bed sores. Let's take a look at what bed sores are, Dr. Anvar.
Hi, Mark. Good to be with you. Bed sores are basically result from pressure from bony areas in your body that are extruding and hitting against usually a surface, which most likely is from the bed. That's why we used to call them bed sores, but now we call them pressure ulcers. So when patients lay in bed and they have more than one medical problem or risk factor, and as our aging increases, we have a heightened chance or probability of developing one of these sores, as we call them, and they can be in various stages and they can be quite challenging to heal. So the best way is to actually prevent the sores from occurring by turning, either if the patients can turn on their own, for them to turn every 2 hours, or with the help of staff, nursing staff, or family members to actually turn patients every 2 hours.
I've actually seen videos and have been in nursing homes and have seen bed sores. They're not only are they ugly and disgusting, they're very painful. They can have an odoriferous element to them, and they should be prevented. But with the staffing in nursing homes, rehab, and somebody who's very ill, this adds an additional complication to whatever is ailing them. Whether it's end of life or whatever, it's still, they feel that, I would imagine they feel the pain.
Yes, absolutely. They're very painful. And believe it or not, most ulcers or bed sores, they actually form when the patients start to go to the emergency room. And let's say, for instance, a patient has had a stroke or any other kind of ailment which has caused them to not be able to get out of bed and walk around. And those wounds are actually forming when they're in the emergency room. They may go to the hospital ICU, and then they're in the hospital bed, and they're waiting to be transferred out. And then usually by the time they arrive in the nursing home, the wound has already developed. And sometimes, yes, they can be very foul. The ones that can extend all the way down to the muscle or bone, which are called stage 4 pressure ulcers, are actually very, very painful. They can have infections in them. They need to be debrided and cleaned, which is what we do in our practice, is to actually remove a lot of that dead tissue. So the best way is to prevent them. But unfortunately in healthcare, the first thing that's on our mind when a patient walks into the emergency room is not to prevent a pressure ulcer or a wound. The first thing that's on our mind is to save the patient's life. And
of course,
other things come secondarily. So you may survive your heart attack or your stroke, and then you may wind up with a pressure ulcer in a nursing home for 6 months trying to deal with that.
And they can last for a long time,
Absolutely.
Well, it just occurred to me, you said that, we're the bony parts of our body, so maybe we should pad our bodies with more fat. Would that prevent the bed sores? I'm being facetious, but at the same time, if somebody has a fat butt, is there less chance of them getting a bed sore, or doesn't that matter?
Actually, you know what? It's kind of funny you ask that, because patients who are obese or patients with obesity are at a higher likelihood of developing a pressure ulcer.
Oh, that's interesting.
Yeah, so you think it's usually in the patients who are not eating, or they're very skinny and they're lying in bed, and they also develop them too. But one of the risk factors is obviously having poor nutrition, not getting enough nutrition, and if that's happening with a patient, they need to eat more. But the real way is not to actually have more fat against the bone, is to actually have that bone completely off the area against anything for at least a couple hours. But they've shown, even if you just remove it away from any pressure for 15 minutes, it will prevent a wound from forming. But the other thing is, of course, if you have a patient that has so many diseases, such as diabetes, heart disease, stroke, thyroid disease, and you just keep adding them on. They can't get out of bed. They have poor nutrition. And yes, maybe they do also have obesity. They're getting at higher and higher risk for developing these wounds. It's generally you or I, when we're healthy and we're sitting and we're able to ambulate, we don't have that risk of developing these ulcers, so we're not as worried about adjusting and positioning ourselves.
I notice that when I go to sleep at night, I tend to move around a lot. And I guess, is that the body telling me, move around a little bit so that you don't develop a bed sore?
Absolutely. We're always adjusting ourselves because we actually develop that pain as well. I'm sure when you're seated in one position for a long time, or you sometimes feel like your leg goes numb, or sometimes we call it like you have a dead leg and kind of have to shake it to wake it up. It's kind of a similar process. But imagine if you have diabetes and that happens in your leg, and diabetics are much more prone to developing wounds in the lower extremities, then you're going to start developing those wounds a lot faster, even though you may even have adjusted your leg. So you're absolutely right. We're always adjusting ourselves. In a patient who's had a stroke, maybe they can't adjust themselves, the risk actually goes up.
From Skilled Wound Care, we have the founder and CEO, Dr. Bardia Anvar, and we're talking about taking care of elderly people. You're a young guy. How'd you decide to specialize in us older guys? I've got a picture of you. You have long black hair, and you're young.
Yeah, well, I'm actually a general surgeon, so I kind of fell into taking care of wounds in nursing homes because the demand for it was just so high. Previous to our establishing skilled wound care, most patients were either being transferred to the hospital to be taken care of in the actual hospital ward, receiving complex surgeries to try to heal these wounds, or they were being sent back and forth to the wound clinic where they're actually sitting in a stretcher or a wheelchair. So we actually are very novel. When I started out, yes, I'm a young guy, so I was driving around all over from Los Angeles to Riverside to San Diego seeing these patients because there was such a need for it, and the practice kind of grew from there. Other people joined to help us take care of these patients. And so now we're completely mobile. We come to the patients. It's unique. We come and see the patients at their bedside at the nursing home. It's excellent for the patients and the nursing facility, and we've had some amazing outcomes. So the demand has become pretty high, and as I'm sure you know.
Absolutely. Absolutely. And one of the things that, I've done some research on this, and there are special beds to prevent these ulcerations. There are ways of turning the patient. At home, when my mother was ill, I could not have taken care of her in my home. And while she did not, fortunately, develop bed sores, I made sure she was rotated, if you will, when she wasn't ambulatory, when she could not move herself. Couple of tips that I've seen in your materials that I'd want to talk about in our remaining moment or two is only bathe for 3 to 5 minutes and only 2 to 3 times a week. I'm a guy who could shower 3 times a day personally, and don't use washcloths. Why not?
Well, the skin, as we age, it becomes thinner and thinner. So the more trauma that the skin takes on, the more it can result in bad things happening, like developing these wounds. So we want to treat the skin mildly. So yeah, that's right. We don't want to use excessive baths because actually, a lot of people think if you soak in water, well, you're going to absorb more water in your skin and your skin is going to be healthier. But actually, the more you soak in water dries out your skin.
Right.
So you want to not excessively bathe, and scrubbing with those towels. I know a lot of people like to scrub the body to get it really, really clean, but it can be kind of caustic to a person's body if they have very thin skin or they have other problems, or if you're using very hot water. And the other thing is when you get out of the bath is while your skin is still moist or damp is to apply the moisturizer. So you just want to kind of towel, blot the skin dry, and then apply moisturizers right then and there, and do it about 4 times a day. The actual moisturizers will keep your skin hydrated, not showering for, an hour. Everybody enjoys that morning shower, even
I get all my good ideas in the shower.
Don't we all?
Don't we all? And that's where you came up with this. Tell you what we're going to do for everybody. We have some tips that you've provided us, and we'll have those up on our website at latenighthealth.com. Just look under the guest tab for Dr. Bardia Anvar. We'll have his picture, his bio up there, and a couple of tips, and a link to his website as well. All of those will be there on latenighthealth.com. Doctor, look forward to talking to you again.
Okay, thank you, Mark.
Thank you very much. This is Late Night Health. Coming up next, our new regular segment on age management. We're all aging, but we don't have to look old.